Okay, my name is Dr. Regina LaRocque. I am a resident of Wellesley, Massachusetts, and I am doing another live feed. So first I'd just like to introduce myself and say who I am and who I am not. My name is Dr. Regina LaRocque. I'm a board member of Sustainable Wellesley. I am also an infectious disease physician and researcher and have been that for more than 20 years. And I am an elected member of the Natural Resources Commission here in Wellesley. I'm also a mother of two 13-year-old boys, and I'm married to my husband, who is also an infectious disease pediatric specialist. And I am here today representing myself, and I have been making myself available to give kind of a concept of what's taking place from my perspective and to help share my understanding of this with my community. I certainly want to underscore how important it is that we all be seeking good sources of information. And these good sources of information include the CDC website, the Massachusetts Department of Public Health website, our local town of Wellesley website. And I do believe that there has been excellent reporting on this topic by the New York Times, the Boston Globe, and I understand the Washington Post as well. I haven't been reading their news myself. So I wanted to direct my comments today to some of the questions that were shared. But I first wanted to just share a few reflections that I've been thinking about over the last 24 hours and that I think are important for people to have in mind as they take a look at what's playing out in our own community. So I just kind of want to, again, emphasize that these are very unusual times, and these are times that have been experienced by other societies in the past, but certainly not within our own lifetime. And so that's an important thing to understand, that epidemics have been an important part of human history. Another comment I will make is that this is a very fast-moving situation, and there is a lot we don't know, a lot of data that are and will continue to emerge, but when things are moving fast, it creates a lot of uncertainty and also anxiety, and that's understandable. It's important to understand that we don't have vaccines or treatments for this virus, and that we are therefore very limited in our capacity to respond to this. The tools that we have available to us are most importantly and primarily the fundamental tools of public health, and that's what needs to be deployed immediately and aggressively. The issue being that we are in the midst of an epidemic where the number of cases are rising, and they're rising exponentially. And so every day makes a difference in terms of the increase in cases and the effect that we can have. The earlier we act, the more effective our actions will be. I also just want to reflect a little bit on just kind of science and society, and I think this is something that has taken me some years to fully understand and articulate, and I think that I've been reflecting a lot on this lately, and I think that we're very fortunate to live in a country that has very advanced biomedical and scientific research and capacity. But I think that it's important to recognize that that is a different sphere than our political sphere, and those spheres have not always talked to each other. We do not have kind of embedded in a lot of our political leadership scientists, and that's just a fact. And I think that we are at a time right now when kind of the best science, the best way of thinking about health, we need to rely on experts, and particularly experts who understand pandemics, who understand infectious diseases, disasters, who understand the healthcare system, and who can help us take quick looks at what other countries have done, what's been effective, what hasn't been effective, and ascertain how we can apply them to the here and now of what's happening in our own circumstances. And so those lines of communication, I think, may not have been baked into the system, and it's something that we will have need for in coming times. So one of the questions here is, as concerned citizens, is there anything we should be pushing our state government to do to get a better handle on this crisis? I think it's a really good question, and I actually think there are many things we can and should be doing as citizens. As I mentioned, it's important to understand that it really is our state leadership that is responsible for the public health response in our state. And so we should be expecting of them that decisions are being made that are guided by the best available expertise and thought on the matters that are playing out in our community. And I think that is a fundamental expectation we should all have. To my mind, that means drawing on expertise, science, and using it actively to inform decision-making and policies. So I think, yes, we should be expecting that. I think it's important to kind of think about what we are going to be seeing play out in the next week or couple of weeks, because that should be the framework that shapes the decision-making that takes place. And so I just want to share my perspective on what I anticipate coming in the next couple of weeks. And I think it's really important for us to take a look at what has transpired in other countries in order to understand that. So it's rather commonly understood, I think, in the epidemiological world that we are about a week behind what has been happening in Italy. And it's important to take a hard look at what's happening in Italy, and that is a scenario where essentially there's a evolving humanitarian catastrophe. And the reason for that is that many, many people are becoming sick and dying in short order in such a way that it overwhelms the healthcare system. And the collapse of the healthcare system is a threat, and it is a crisis. And that is what we are looking at. And so I think, Tony Fauci said very appropriately, we need to be skating to where the puck is going to be. It's the Wayne Gretzky analogy. So we need to be mindful of the fact that what we are preparing for is a looming collapse of our healthcare capacity. And what do we need to do to try to prevent that now by taking the most aggressive actions we can? And what are we doing to prepare that healthcare system to withstand what will be a very difficult onslaught of sick people? And I talked before, and I just want to reflect again on what that looks like, because I think it's important to recognize that medical professionals, medical societies are embarking on the very difficult conversation around how healthcare workers will address the inability to save some people. And it's something that we have not ever in our experience, at least in the healthcare systems that we work with here in the United States, had to commonly deal with, or at all deal with, the notion that we don't do everything to save everybody. And these are hard things to get your head around, but I think it's really very important for people to understand that that is the crisis that we are all trying to avert. It is a crisis that will affect everybody in personal ways and will have a particularly profound, I would say, psychological impact on people who work in the healthcare profession. And so we are girding ourselves for this, and I'm sharing with whoever's watching that is what is taking place. So we should be skating to where the puck is going to be, which is, in the coming week, we are going to see people dying. And so what we're doing now with distancing and trying to slow down the epidemic is crucial, and it's crucial for everybody's health. So somebody's asking here about social distancing and why it's important. So I believe that is what I was addressing just a minute ago, which is that since we don't have treatment tools, we have to prevent the ongoing spread of this virus. And it's kind of the slogan of Physicians for Social Responsibility, which is an organization I'm also affiliated with. And you have to prevent what you cannot cure. And it is very similar here. So again, just to remind everybody about how respiratory viruses are spread, remember the key is droplet spread. So coughing, sneezing leads to a release of droplets that have the virus in them. These droplets then fall, land on surfaces, and can survive on those surfaces for some time. Other people come and they may touch the surface and then touch their face, or they may be close enough that these droplets can kind of be breathed into their airway. And so staying at least 6 feet apart, protects us from that zone in which people may be coughing or sneezing. And then disinfecting and cleaning is the important way to prevent the transmission of viral particles from surfaces to your face. It's essential. So another question is coming up about the topic of aerosols. And so I mentioned this before, and I'm just making the point that it is well known that viruses can also become aerosolized, which is a different way of spread, where the particles are not simply attached to droplets of liquid, but they are kind of floating in the air. And that can occur under special circumstances with particularly any virus. Some of those special circumstances we worry about in the healthcare setting is when somebody is having their upper airway intubated or manipulated. And so when a virus is aerosolized, it's much more readily spread between people. This is why infection of healthcare workers is a big concern. So one question relates to, is it safe to eat uncooked food like lettuce? I think that I don't want to get too much into the weeds on food, but I do want to say that in general, it is a good practice, and I think it is particularly important in the setting of this outbreak to understand that food, it's really only in the United States where we feel comfortable eating uncooked vegetables. I'm going back to what I said before, which is the notion, if you just think of the world as being covered with a thin layer of poop, it changes the way you think about everything. And so in practice, it's really better not to eat uncooked vegetables because you're eating the surface. So if you have to eat things that are uncooked, you have to wash them thoroughly and peel them before you eat them. Or even better, you cook them. And I think that nowadays that's a good practice for everybody to be thinking about. So that would be my answer when it comes to eating uncooked food. And some people are asking about risk factors, and I think it's important to remember that there are some risk factors for becoming more ill with this, and that is why protecting individuals who have these risk factors is important. So those risk factors are things like being older or having an underlying medical condition, or having a compromised immune system. But I think it's also important to recognize that there are certainly many people who do not have these risk factors, who have become very critically ill with this. And so we should not be overly confident that just because any given person is otherwise healthy, that they are completely protected or completely spared the possibility of having a severe infection. And that is, I think, important to remember. I think another key point that sometimes has not penetrated our minds is the notion of the fatality rate here, and how to kind of understand the difference between what on the one hand seems like a very low fatality rate, somewhere between 1% and 3%, and how that translates to our understanding of the situation. And I just want to convey that there's a difference between a percent and an absolute number. And because we know with this particular virus that everybody is susceptible, that everybody is going to become infected at some point, if you conceptualize the idea of 1 to 3% of everybody becoming critically ill and dying within a very short time, that is a rather overwhelming number. And so that is the difference really between conceptualizing things as a percent and conceptualizing things as a number. Somebody's asking about an advice for large buildings with elevators. Well, it's a good question, and I was thinking about that myself in the context of my husband having to go into work. I think in general now is the time to be staying away from enclosed, poorly ventilated spaces where we are in close proximity to other people. And frankly, that is the definition of an elevator. So I think that it would be prudent to stay away from elevators as much as possible. It kind of brings me to a bigger topic I've been thinking about too, which is, I believe that the gravity and the severity of what is occurring now feels, and it has felt to me actually, rather disconnected from the public health messaging that predated the current situation we were in, which focused a lot on hand washing and things like that. And I think that I just want to recognize that. I mean, of course, hand washing and putting in practices about regular cleaning your home were all very important messages. And that is actually a very important piece of what we need to be doing actively now. But I think kind of combined with that, it's another very important message was really the kind of overall gravity and disruption of what an epidemic is. And I think it was sometimes hard for people to hold those two things in their head at the same time, that on the one hand, an epidemic, a tidal wave was coming, and on the other hand, I'm washing my hands. And so I feel human beings have a hard time sometimes holding two thoughts that seem a little antithetical in their head at the same time. And it's, I think, just a reflection on what situation we're in, because the reality is that hand washing and other personal measures are important, but on the other hand, there is a lot of societal and political and public health measures that need to be paired with all of those individual actions. And so it kind of brings me back to the notion of the important understanding that it is our elected leaders who are now responsible for leading us through this crisis that we are in. And my expectation is that that leadership needs to draw on existing expertise that can look carefully at what has transpired in other countries and what we see emerging in our own communities as needs, and rapidly mobilize to respond to that. I think those are the things that I was thinking about today. I don't see any other. Let me see if there's any questions that popped up down here. Yeah. So I think I just want to end with the thought that each state's governor now has tremendous responsibility for what transpires in our community. And they really are the general that needs to lead us through this crisis. And so I think that it is entirely appropriate for us to be looking to our generals to be doing the absolute best, to be their A-team in this. And in my mind, we need to be taking a bazooka to the topic of the health crisis we are facing. That bazooka is going to need to be deployed sooner rather than later, and it will have effects on other aspects of our lives. We need to protect ourselves against those effects, but we need to have our eyes on the fact that protecting the health of our communities, protecting the infrastructure of our healthcare system is the preeminent need in the short term. Of course, there will be economic fallout and other challenges that arise. Those need to be mitigated, but if we picture the fact that we are about a week behind where they were in Italy, where thousands of people have been dying by the day, we have to focus our attention on the urgency of addressing that looming catastrophe. And I think that is the prize. We need to be skating to where we will be in a week, which is an overwhelmed healthcare system. Somebody's just asking about what the healthcare system is looking like now. Well, I think that, again, I can only speak for the small window that I have into it, and I'm not representing anybody other than myself. But there are challenges that are massive in terms of what we're seeing now, dealing with the numbers of individuals who have respiratory illness, sorting out who has COVID and who doesn't, having had to clear the decks of all other workflow, just from a purely personal perspective, our laboratories have had to shut down. We have had to kill laboratory animals. The research infrastructure has been stopped. And all of the other kind of medical activities that are not focused on this effort are stopping. So that has big implications for people who have healthcare needs outside of the current epidemic. But our healthcare system has been working to be prepared for this, but it is a tidal wave, and an important component of being prepared for that tidal wave is recognizing that the healthcare system itself, in the course of an epidemic, can become the center of driving the epidemic, because sick people are coming to healthcare centers. They are concentrated in one place and then allowing infection to spread out from the healthcare setting itself. So separating people who have COVID from those who don't, protecting healthcare workers so they don't get infected, protecting the families of healthcare workers and the children of healthcare workers so they don't get infected, and then seed the community. These are all important logistical, practical concerns for the healthcare system, and how to safely continue to provide other care when you're dealing with a tidal wave of illness from an epidemic. So that is a lot to ask of any system, and it is logistically difficult to orchestrate, and to keep up with the emerging information about how we best should be preventing infection. So it's overwhelming. And I think we've already seen that even in the early days of this epidemic in the U.S., our healthcare system is overwhelmed. So it is concerning about what the coming days hold for everybody. On top of that, we have some very fundamental supply issues. There already is a shortage of some fundamental supplies, and we know that we do not have enough ventilators in our country, enough intensive care beds in our country to deal with a flood of people. So our healthcare system is gearing up to have to do some very difficult triaging of who lives and who dies. And so we need some protocols in place of how to do that prospectively, and we need to be mindful of the mental health challenge that is going to pose for people on the front line. And I kind of, in this setting, am thinking a lot about how talking to people about end-of-life issues has always been hard, and now is a time when we should all be having those conversations that we probably should have had a long time ago, making sure that our wishes are made clear. And we need to be insisting that we apply every possible production, acquisition chain in order to ensure that healthcare workers have means to protect themselves from getting ill. And I'm still waiting to see how that plays out, because it's unclear that, well, we don't have that capacity right now. We don't. And that is frightening for people who are in the healthcare field. On a personal level, I really had to scramble just this last 24 hours to figure out a way to live separately from my husband, who's going to be working in the hospital. So somebody is going to have to help us with dormitories or other places where healthcare workers can live separately from their families in a way that allows us to make sure that we aren't spreading virus from the healthcare setting out into the community. So I think I'm going to stop there, and I tried to respond to the questions that I saw today, and if I have time, I will try to do this again. Okay, thank you. And again, I just lastly want to end by saying I'm only representing myself. I am one person who doesn't have every piece of information about all the components of what's going on. I'm not in a position of authority. I'm merely representing to you my knowledge and understanding of what I see happening, and making myself available as a person who lives in your community. So thank you. And I appreciate everything everyone is doing to follow the guidelines and to really insist that our state leadership show that Massachusetts can be the state that draws on expertise and does the absolute best in responding to this crisis.